Joining us right now, Pennsylvania Senator Pat Toomey. Senator Toomey, thanks very much for joining us.
Good morning, Maria. Thanks for having me.
Do you think there are the votes in the Senate to get a bill to the floor?
Well, that's the big question, right? I don't know the answer. We'll see the actual legislative language of the bill. I think many of us are pretty well aware of most of the main features, but we'll have a chance to really scrub it closely. We'll get a score from the CBO, and then we'll find out whether we've got the votes. I think it's very close. I hope we will.
Where is the most disagreement in terms of not getting the vote? I mean, where would the sticking point be?
Well, you know, I think a lot of it comes from a frustration given the procedural constraints we're operating under. The president's exactly right when he says that the Democrats are obstructing this process. There's no Democratic senator that's willing to work with us in any fashion on this project because they have too much at stake in Obamacare. They feel so invested in it. So we have to use a device that allows us to pass legislation with a simple majority instead of the usual 60 votes. And that device also constrains what we can do. For instance, many of us would like to peel back many more regulations than this procedure allows us to do. So we have to settle for the best we can, which is pretty extensive, but not as far as some of us would like to go. And so for some of my colleagues, I think that's a hard pill to swallow. But, you know, again, we'll see when we actually get the legislative language.
But do you think your colleagues understand the ramifications if they're not on the same page? If you don't get health care done, if you don't get a bill, it holds up tax reform. It creates lots of calls for you not to take a vacation in August. It creates lots of expectation that you're going to lose seats in 2018. The Dems get the House and then move to impeach President Trump. Everybody is aware of those issues.
I think everybody is aware, and you left a few out, which is given the complete implosion of Obamacare, if we can't do this, stabilize the markets and make the reforms we want to make, then what happens? We can't just walk away from this. We'll have to find out what the Democrats are willing to do, and that's going to be a big movement to the left. I mean, they want single payer. So no, I think there's a great deal at stake. And most importantly, we've been promising this for 7 years.
That's right. Caitlin.
Senator, it's Caitlin Huey-Burns here. One of the big issues of contention among some of your colleagues is this Medicaid phase-out. I know that some have expressed concern about the process of that. What are your conversations like with those colleagues, you know, from Ohio, from West Virginia, from other places that are concerned about that component?
Well, it's often been very grossly mischaracterized, so let me tell you what we're actually doing in this bill, because I've worked on this part pretty extensively.
Right.
First of all, we're going to make the Obamacare Medicaid expansion permanent. We are going to codify it. We're going to lock it in. It's going to be a permanent part of Medicaid. This new category of eligibility is going to remain, and that is young, able-bodied adults with no dependents. Never before were they eligible for Medicaid. Obamacare made them eligible, and we will retain the eligibility for those people. What we are going to do is, over a 7-year period, we will gradually transition from the current 90% federal contribution towards the cost of covering these people to the ordinary share that the federal government pays for all the other categories of Medicaid beneficiaries. I think it's perfectly reasonable to ask the states to pay their fair share of this for a program that historically has been a shared responsibility. Last thing I would point out that we do add to this is 8 years from now, we have a provision that very slightly slows down the rate at which Medicaid will continue to grow, so that this is actually a sustainable program. I think it's very reasonable.
You said you think that it's fair to ask the states to pay for Medicaid. Is that where one of the big disagreements is as well?
You know, actually not terribly much. I think that the argument among Republican senators has more been how quickly we get to that point. I think there's been a pretty broad, I don't want to speak for all of my colleagues by any means, but I think there was a fairly broad consensus that it is entirely reasonable to transition to a point where the states are paying their share, which, by the way, is less than half the cost, considerably less in many, many cases, and is the share that the states pay for the other categories, like the elderly, the blind and disabled, children, pregnant women. So, no, I don't think that's been a main point of contention.
Mitch.
Senator, if you just look at what's happened in the last week or so, we see big payers not choosing to be in certain states, and even in some cases their own home state. if that happens and that trend continues over the next couple of days and weeks, is that going to put more pressure on perhaps the Democrats to sort of get on board with the plan because there's going to be no health care for individuals in some of their states?
Well, you're absolutely right. The status quo is absolutely failing. You know, people lost the plans they said they were told they could keep. They lost the doctors they wanted to have. In my state of Pennsylvania, 40% of Pennsylvanians have a grand total of one choice. That's not a competitive market. 19 of the 24 Obamacare co-ops have already gone bankrupt. They've failed. So the status quo clearly is not working. What we've got is going to halt the bleeding. It's going to stabilize these markets. I think actually it'll bring insurance companies back into the markets because they will see a viable way forward. So let's hope we can get this passed and start repairing the damage that's been done.
What about tax reform, Senator? Where are the disagreements there? What's your most important priority as it relates to the tax conversation?
Well, for me, it's much lower marginal rates, especially on American business, because our business tax regime is completely uncompetitive. But it's also really important that we fix the international piece where we uniquely put our multinationals at a disadvantage. And I think we should have a very long-term tax reform so that the structural changes are things that business can plan on and make investment. I think we're capable of much, much stronger growth than we've had if we can get tax reform done right.
What corporate rate would you like to see? 20% or lower?
Look, if we could get to 20%, that would be fantastic. I think that would be a tremendous improvement from the 35% rate that we have. We need to make sure that pass-throughs get an equitable treatment if we do that, and I really hope we can accomplish that.
All right, we'll leave it there. Senator, good to see you. Thanks so much.
Thank you.